Hi everyone, I am Dr. Venkatesh, Professor, Department of Conservative Medicine and Endodontics from Sri Balaji Dental College Hospital. Today, the topic for the discussion is isolation. What is isolation? Whatever the procedure we are performing, we have to do the proper isolation that which prevents in many ways. So today, we are talking about only the isolation of teeth when we are doing the procedure. What is isolation? Isolation of operating field refers to isolation from moisture like saliva, blood, and gingival circular fluid, and isolation from soft tissues like lips, cheeks, gingiva, and tongue. These are the isolation. Isolation means we have to isolate from the adjacent tooth structures by performing the procedure. This is isolation. So, what are the procedure? We have to set certain goals. The goals of isolation are moisture control, retraction and access, and harm prevention. What is moisture control? Excluding circular fluid, saliva, gingival bleeding, preventing the handpiece spray and restorative debris from being swallowed or aspirated by the patient. Improved properties of dental materials. These are the certain moisture control that when we are doing the procedure. What is the retraction and access? Retraction provides the maximal exposure of the operating site, for example, the tooth, and it involves maintaining an open mouth and depressing or retracting the gingival tissue, tongue, lips, cheek. Harm prevention. Like when we are using some sharp instruments or rotating burrs, that it should have prevent from the adjacent soft tissues. So to preventing the patient from being harmed during the operative procedures on strong medicaments. Excessive saliva and handpiece spray can alarm the patient. Small instruments and restorative materials can be aspirated or swallowed. Soft tissue can be damaged accidentally. So these are certain this thing we can able to damage the adjacent tissue. So to prevent from the harm prevention, it should provide isolation. Next one is the main criteria for the isolation. What we use is a rubber dam. So what does it mean by rubber dam? Rubber dam was introduced by dental profession by Sanford Christie Barman in 1864 from his practice from Ponsell in New York. So what are the advantages of using rubber dam? The main property for isolation is to have a dry, clean, and visible field. Second one is protection of the patient and the operator. What are the protection we can apply? Prevents the possibility of aspiration or swallowing debris associated with the preparation and the restoration of the tooth. Permit prompt recovery of instruments that may be dropped. Protect the soft tissues from medicaments that may be irritating or distasteful. For example, bleaching agents or irritants like sodium hypochlorite and saline, the trees will not be very good, so that it may cause discomfort to the patient. So that all we protect, so that once we use the rubber dam, we can eject from through the saliva ejectors. And the soft tissue protection from rotating burrs, stones, and diamond. The operator is afforded protection from saliva splatter and aerosol. So it acts as a vice versa for both as the operator and the patient. What are the economical factors? Time involved in letting the patient rinse and expectate is eliminated. Excessive patient conversion is eliminated. Aids in patient management. And it will enhance the properties of the dental materials, which it will improve the properties of dental materials. Retraction of the soft tissues. The dam will retract the marginal tissue, providing better access to and vision of aspects of the cavity preparation that extend near or to the field gingiva. The lips cheeks, as we mentioned earlier, the lips cheeks tongue are retracted with the rubber dam. What are the disadvantages of rubber dam? It might be a bit time consuming, like time consumption and patient objection, because it will be not comfortable for the patient as it's like quite disadvantages. What are the conditions which preclude the use of rubber dam? When we are using rubber dam with end permanent teeth that have not developed sufficiently to receive a retainer, almost to the molars, extremely malpositioned teeth, asthmatic patients, mouth breathers, upper respiratory tract infections. So these are certain disadvantages. And we have to have some caution while using metal clamps and rubber dam. Like rubber dam is made up of latex, so latex allergy Improper selection of clamp can cause gingival trauma. Microscopic defects on stainless steel crowns. Ceramic crowns can fracture at the margins if clamp is allowed to grip the porcelain, and in few cases it might be aspiration of clamp. These are the action while we are performing the Davada. What is the rule? We have to set a certain rule for rule. What are the ABCD of Davada? A stands for adequate access and visibility in the operating field. B, better patient protection and management. C, control of moisture in the operating field. D, decreased operating time. So, what is the rubber dam kit comes with? Like it comes with a rubber dam sheet, rubber dam holder, rubber dam napkin, rubber dam punch, rubber dam template, rubber dam clamps, rubber dam clamp forceps, and lubricant. These are the kit that the rubber dam will be using. These are the rubber dam sheets, and the material made up of rubber dam sheet is a natural rubber latex, which is available in pre-cut sheets. Measurements like 6 into 6 inch size for adults and 5 to 5 inch size for pediatric users. And it will be colors also. It will be like for color coded. It will be like colors green, blue, pink, purple, with centered and non-centered. Both are available. Now, what is the thickness of the dam material? It has been categorized as thin, medium, heavy, extra heavy, special heavy. So, thin means it refers as 0.15 millimeter. Medium stands for 0.20 millimeter. Heavy stands for 0.25 mm. Extra heavy is 0.30 mm. Special heavy for 33 millimeter. So it depends according which we want to perform. Like next part is rubber dam holder frames. It will be available in both metal and plastic. And we call it as Young's frame, commonly used as a metal as well as of plastic. And this is for popularly called as endodontics. Is a plastic and popular for endodontic procedures, especially. What are the functions? The functions that support the edges of the rubber dam, retract the soft tissues, improve access to the isolated teeth. So these are the rubber dam clamps, which perform. This is a metal clamp, this is a plastic clamp, and yeah, this is the Young's frame. Already, as I mentioned, this is the Young's frame metal, and this is the same Young's frame plastic, which is made in nylon. This is especially for endodontic procedure, as I mentioned earlier. This is the night guard has to be frame. And down is the foldable frame, covered and frame, hinged in the middle to fold back for the easier access for the radiograph. When we're taking the radiograph, we have to close it and be easy for convenience of the operator. And next one is rubber dam punch. So in the rubber dam punch, initially we call it as an ivory punch. Another one is Answer cut, which we have to take the rubber dam sheet, which is made up of rubber. We have to use the template, and we have to mark the tooth size, and we have to select the size accordingly, and we can see the sizes, holes of the sizes, which is the holes can be punched in a range of 0.5 to 2.5 millimeter according to the size of the tooth. The successive hole interval of 2 millimeter. These are the punch table for rubber dam punch. So these are the tags which we call it as nick, tap, and correct. Then the next one is the rubber dam retainer forceps. The rubber dam retainer forceps is used to placement of the retainer, which we are going to place it on the tooth for the isolated surface, or used for both the placement and removal of retainer and retractors. Rubber dam clamp forceps. The parts of the rubber dam forceps are. It has Stokes Ivory Burton, University of Washington. What we regularly use is University of Washington for the one we regularly use here. What is the rubber dam retainer clamps? Consist of 4 prongs and 2 jaws connected by a bob. Anchors to most posterior tooth to be anchored. Different sizes and shapes for various clinical situations, and it has both wing and wingless. That variance is available. So this is the part of the rubber dam clamp which it has a bow which connects both the structures, and this is the hole which to perform the rubber dam forceps which used to held, and that is the retainer, and this is the jaw, and this is the prop, and this is the tooth section at the level of propping tips what we have selected earlier. Clamp selection guidelines. These are the clamp selection guidelines. You see the arrangement which we have placed is like it has to be across the tooth properly, and there should not be any space. So which we end up with the bow should always be distal. All the 4 points of the jaw are in contact with the anchor teeth. The clamp should grip the crown of the tooth below its maximum coronal diameter. And we have talked about winged and wingless. And this is we call it as wing, which is specific in the hygienic goods, and this is the wingless clamps which will be available to the appropriate isolation. And the distally extending bow for operating the distal surface on the anchor tooth. This should be placed on the distal surface of the tooth, whereas otherwise it will interrupt while you are doing the tooth for performing tooth. Pole positioning guides. Teeth as a guide. Mark teeth with the felt pen, templates, and rubber stamp stamps. This is the rubber stamp template, which it has been categorized as a quadrant, first quadrant, second quadrant, third and fourth. Accordingly, we have to select the tooth and we have to do the punch. Rubber stamp napkin, it prevents the skin contact with the rubber to reduce the possibility of allergic reactions, and it absorbs saliva at the corners of the mouth, and it acts as a cushion. The lubricant, it's generally a water-based lubricant or also preferred rather than petroleum-based for easy placement and removal of the rubber dam. Applying the clamp and the dam. Dam over clamp. There are a few techniques. Dam over clamp, winged clamp in dam, wingless clamp in dam, clamp over dam. And these are the techniques as we mentioned earlier. It is placed, the bow is placed distal. Which is one is winged and the other one is rounded. And in the isolation, we have to see about the gingival retraction card. Gingival retraction card is accomplished by use of retraction of cords, heavy rubber band material, butterfly stamp clamp cords. And this has been method as chemomechanical method also. Ready-made cotton or synthetic woven cords may be supplied. Chemically impregnated between the chemical structure. 3 basic designs are available: twisted, knitted, braided. Knitted cards are preferred than twisted one. Knitted chain-like structure, as it absorbs the circular fluid, the chain swell up and exert the outward force to displace the gingiva. Desirable qualities of the card, according to remarks beyond Lansman 1984, dark color, contrast with tissue, tooth, and card. Absorbent, wet medicament, different diameters, varying morphosis and gingival surface, safe locally and systematically, and chemostasis. And as we see, like it is universally color coded according to the sizes, which stands for black stands for 000, yellow is for 00, purple 0, blue 1, green 2, red 3. Objective of card placement: to obtain minimal yet sufficient lateral displacement of the free gingiva and not to force it more epically. Debris and fluid evacuation equipment. Types of evacuating systems. Equipment to be left in the mouth during the procedures, or saliva ejectors. Equipments to be used intermittent high-speed evacuators. And the main one is saliva ejectors. It may be made up of metallic or plastic. We should have a rubber or plastic tube to avoid irritating the tissue. Most frequently used are the disposable types. High-speed evacuators preferred for suctioning water and debris. Cutting off both tooth and restorative material as well as other debris are removed from the operating site. A washed operating field improves access and visibility. There is no dehydration of oral tissues. Another one is called the doctor, introduced by Easy Moore, both saliva ejector and tongue retraction device, which is used in absorbing the fluids, fluid absorbing materials like cotton balls, gauze or throat shield, absorbent paper pads or wafers. Cotton rolls serve as both moisture absorbents and retraction devices. They are generally used as alternative when rubber isolation is not practically possible. Provide acceptable dryness for procedures like examination, cementation, sealant placement, topical fluoride application, etc. It is usually used in combination with saliva ejectors. They are available as both as loose cotton or prefabricated rolls. These are the cotton rolls. We are very much exposed to the cotton rolls, and these are the glass sponges which is used for dry surface, and the throat screens. Throat screen can be used to avoid aspiration, like when we are performing the crown routine or when you're doing the RC files, when minute instruments are being used without rubber dam or indirect restriction, such as castings or terms are being tried. Note screens can be used like in this way, and it can be used for aspiration of instrument or casting. And next one is carotid sheet, the absorbent pads made up of cellulose, available in triangular shape, thin and absorbent wafers, improve access and visibility to working field, and very comfortable for patient, usually placed in the vestibule covering the carotid duct orifice. Tissue retraction and protection, tongue guards, tongue depressors, cheek and lip retractors. Tongue depressors can be protected by using the tongue depressor, which lowers the tongue, as to avoid interference during the operative procedures like preparation of the tooth or whatever the procedure when we are performing. These are the tongue guards and tongue depressor, and disposable wooden tongue depressor also can be used. Cheek retractor and lip retractor, like performing orthodontic procedures or performing the bleaching, it can be very useful for isolation. Usually it fit around the upper and lower lips, including the corner of the mouth, and help in pulling them backward and outward, exposing the facial surface of the maxillary and the mandibular teeth. Used mainly for photographic purposes and working on anterior tooth. Tongue and cheek retractors prevents the tongue from pandering on the working area, offers an extension bar, allowing the patient to write down, alleviating fatigue. It can be coastal, available in 3 sizes, which each pack contains of 10 retractors. And drugs, rarely drugs in dental practice have systemic medical implications. Anti-salivates, drug inhibiting salivary secretions, like anticholinergics, atropine like drugs, it can be used. So, thank you. And these are the few techniques for isolation. And isolation is the main consideration when we make the performance. Thank you. Thank you for listening. Thank you, everyone.